Children will potty train faster and more successfully when you praise them for having dry underwear. Between scheduled toiletings, do dry pants checks every 5 to 10 minutes. Ask your child, "Are you dry?" and then have them feel the crotch of their own underpants. You can check too to verify your child's report. If they're dry, the child should be reinforced by social praise. "Good job, your pants are dry," and occasionally reinforced by giving them a small snack or a treat. After a child initiates toileting by his or herself, fade the dry pants checks to every 15 or 20 minutes. After 3 completely independent successful toileting trials, reduce dry pants checks to every hour. Let's talk about what to do if your child refuses to use the toilet. First of all, you want to figure out what it is they don't like about the toilet. Is there a true fear? Are they afraid they're going to fall in? Do they not like the water? Do they not like the sound? When you figure out what it is that they don't like about the toilet, then you can address the fear by fixing the problem and slowly getting them to use the toilet. Such as, if your child does not like the water in the potty, then you can drain the potty so there's no water in it. If they don't like the sound that the toilet makes when they pee, you can drain the water, or you can just put some toilet paper in the water to sort of muffle the sound. If they're scared of falling in, then make sure that you have a potty seat that's stable and allows them to feel comfortable and stable on the potty, or consider using the training potty instead of the regular toilet. If your child is scared of an automatic flush, put a post-it note or cover the sensor so the automatic flusher won't scare them. If your child refuses to use the potty or throws tantrums when transitioning to the bathroom, and it's not because of fear, then it's vital to figure out why they don't want to use the potty. The reason might be your child is engaging in a desirable activity like playing and has to switch to an undesirable activity. So it is helpful for you to make using the potty more fun and desirable. If this is the case, then you can give your child a lot of fun toys and books to do while he or she is sitting on the potty. You want to give them a reward every time they're successful in using the potty, and you want to make sure that they have lots of things to do while they're using the bathroom. Now, there are 3 ideas to teach children to stop playing in order to go to the potty. Idea number 1 is to sing a song. Not only does singing enhance memory and learning, but it also makes potty training more fun. Songs are great mnemonic devices, and music can make it easier for a child to retain information. Some examples are, "When you have to go potty, just stop and go right away. Flush and wash and be on your way," from Daniel Tiger. Or, "When you get that funny feeling, way down low, just stop what you're doing and go, go, go," from Cocomelon. Idea 2 is to provide reminders. It's important to provide your child reminders to stop and go to the toilet. Your child's still young and may become so engrossed in an activity that they forget that they aren't wearing a diaper anymore. Setting a timer is a great way to remind yourself and your children to take a break and go potty as well. If your child spends too much time out of close proximity to supervising adults or trainers, or has a hard time stopping activities to use the restroom, it might be necessary to employ a pants alarm. Idea 3 is to make it routine. It's great to have scheduled potty breaks throughout the day. This may help reduce the number of reminders because the child knows that after breakfast, lunch, and dinner, they need to use the potty. Before they go to bed, they need to use the potty, etc. It will also reduce the potential arguments because your child doesn't want to stop playing to use the potty. Accidents. Potty training is a learning process, and there are times when children will have accidents. But what do we do about accidents? When an accident is detected, either by a pants check or an alarm, the child should immediately be taken through the positive practice procedures for urine accidents only. These are the step-by-step instructions for positive practice procedure. Step 1. Make eye contact with the child and, in a neutral voice, say, "Oh no, you had an accident in your pants." Be sure not to come across as mad. However, don't provide much attention either. Try to remain neutral. Step 2. Immediately and quickly guide the child to the toilet using the prompts described earlier. Step 3. Prompt the child to change his or her pants. And Step 4. Have the child proceed through the entire toileting sequence 5 times. The sequence proceeds as follows. The child walks to the toilet, lowers their pants, briefly sits on the toilet for 3 to 5 seconds, then stands up, raises their pants, then returns to the place where the accident occurred. Each positive practice sequence should begin as close as possible to the point where the accident occurred. This is referred to as positive practice. It's a behavioral technique that teaches children what they should do next time they have the opportunity. Such repeated practice is said to help the child adopt the behavior in their repertoire. Following the practice, previous activities and scheduled toiletings can be resumed. There are some important points to keep in mind concerning the positive practice procedures. As mentioned earlier, the procedures should be implemented immediately upon detection of an accident. During practice, you, the trainer, should adopt a matter-of-fact, non-punishing, and non-rewarding attitude and demeanor, like a neutral tone of voice. As far as possible, only the minimal guidance and prompts necessary to complete the steps should be used. Such minimal guidance during positive practice, as well as during scheduled toiletings, will encourage independence in the child's performance of toileting behaviors. Do not use positive practice for bowel movement accidents. Only require that the child help clean up the mess. Finally, positive practice should be conducted at least 5 times. The child should never be allowed to get out of practice by throwing a tantrum or refusing to participate. While the child may show resistance, a matter-of-fact and firm attitude by you, the trainer, using as much guidance as is necessary, should rapidly teach the child that the practice is necessary and an inevitable consequence for accidents. If the positive practice is conducted immediately, consistently, and thoroughly, the child should quickly learn the routine and, before long, learn to use the toilet instead of their pants.